Hello everyone, this is Bonnie Poppy, and I would like to present my policy brief on the United States Senate Bill 1324, titled the Childhood Obesity Reduction Act. As a cardiac nurse for 15 years, I see health problems and complications associated with obesity in adult patients, and I feel that starting to prevent the epidemic of obesity with children early on in life is important. And the Childhood Obesity Reduction Act focuses on involving Congress in the prevention of childhood obesity. The issue is that obesity in children and adolescents in the U.S. continues to rise. 1 in 6 children and adolescents ages 2 to 19 are affected by obesity in the United States. Despite some reports that childhood obesity rates had leveled off, more recent studies found that now it's continuing to increase, with a sharp increase in preschool-age children. And childhood obesity costs Americans about $14 billion a year. Some background on the issue. Behaviors that lead to obesity in children and adolescents include eating high-calorie, low-nutrient foods and beverages, not getting enough physical activity, and sedentary activities, including large amounts of screen time. Children who are overweight or obese are more likely to develop serious physical health problems such as diabetes, high blood pressure, asthma, sleep disorders, and liver disease. Also, psychological health problems have been linked to childhood obesity. These include low self-esteem and social isolation. Children who suffer from being overweight and obese are more likely to be obese as adults, leading to costly and debilitating long-term health problems that are associated with obesity, such as cardiovascular diseases, type 2 diabetes, stroke, certain cancers, and osteoarthritis. The United States Senate Bill 1324, Childhood Obesity Reduction Act, hopes to establish a Congressional Council on Childhood Obesity to encourage every United States elementary and middle school to develop and implement a plan to reduce and prevent obesity. It was introduced to Congress by Senator William Frist in 2005, and the co-sponsors are Senators Ron Wyden and Mike DeWine. A related bill in the House of Representatives is Bill 4860, also titled Childhood Obesity Reduction Act. And after being introduced, it was referred to the Committee on Health, Education, Labor, and Pensions. The intent of the bill is to encourage schools to develop and implement local school-based programs designed to reduce and prevent childhood obesity by promoting increased physical activity and improved nutritional choices. The summary of the bill includes activities for the Congressional Council, and these are to develop a congressional challenge to schools. Similar challenge program called Healthier Us is a component of former First Lady Michelle Obama's Let's Move initiative. Under this initiative, over 3,000 schools have been certified at different levels as of December 2017. But Healthier Us will no longer be accepting applications after this school year, creating a need to continue the process. Other activities of the Council would be to develop and maintain a website on best practices to prevent childhood obesity, collaborate with the President's Council on Physical Fitness, reward elementary schools, middle schools, and other local educational agencies that submit a program, by formulating a foundation to fund awards. These awards would be based on the success of the school's program and the amount of children that it helps. Then these successful programs would be designated as model plans for reducing and preventing childhood obesity, and then would be provided to secondary schools in the hopes that they would be recreated. Some unintended consequences if the bill is passed. Children would receive healthier food at school, but what the child eats outside of school would not be regulated. The national school lunch and breakfast programs already have been regulated since the signing of the Healthy Hunger-Free Kids Act of 2010. Some of these regulations include like whole grain requirements, limited sodium content, and the amounts of fresh fruits and vegetables that need to be provided. And since then, some schools report that kids dislike many options in the daily menus. The food is being wasted, and then kids are hungry. The fiscal estimate of the bill, the nonprofit foundation established under the Childhood Obesity Reduction Act would be funded by donations to the foundation and an annual grant of $2,200,000 per year. The foundation would have its own voting board of directors, and the annual grant would come from the Department of Health and Human Services. Preventative interventions taken to reduce childhood obesity actually are cost effective, and they cost less than the amount that would be saved in healthcare costs over the next 10 years. Among these preventative interventions was school lunch and breakfast programs that met national nutritional guidelines. The stakeholders of this act are the food industry. The food industry is lobbied to create laws that would prevent possible liabilities associated with obesity, and it also continues to fund members of Congress to secure riders that delay efforts that reduce sodium in school lunches. The United States elementary and middle schools, most American children attend school, making it a significant setting to implement the strategies to prevent childhood obesity. Parents and healthcare providers, it's important to understand their perceptions of the programs that are being implemented to reduce childhood obesity, because this will contribute to whether they are successful, because these people are providing care to the children involved. My recommendations are to pass the Childhood Obesity Reduction Act. Preventative measures have proven to work and are cost effective. Offering a challenge to schools with incentives could encourage new ideas, and then these successful ideas could be replicated in other schools and communities. I would also add to put a focus on preschool programs and adolescents. American children are entering kindergarten already obese or overweight, and adolescent females are a demographic where obesity rates show a high increase. Also, I think getting families involved would be beneficial. Children need reinforcement after leaving school, and it could benefit the adults as well. Thank you for listening to my presentation. Have a great day.